So looking at another records, this is what is known as a maternal death audit. So audit is like something happened, so I'm trying to go back, all right, and look critical at the thing. Do you understand? Maybe I found a reason for why that thing happened, but I'm still going back to look at the reason, like, bro, was it actually this reason that made this thing happen? You get? So that's just what audit is. So if a woman dies during pregnancy, or when she's giving birth, or after giving birth, is it nice for me to actually go back, and try to like evaluate, what actually made her die? Okay. So it's just it's a confidential review of maternal deaths, and it's aimed at understanding the medical factors that caused the death, the social factors that caused the death, all right, if there was any issue in the hospital that also contributed to the death. All right, now this will help you, all right, to avoid these issues later on. Do you understand? It's not all about pushing blames, all right? That's why I put it there. So what it involves, you have to review, like, since this woman came to the hospital, what were the records that were coming on her? You want to review everything, including all the doctors she came in contact with and the things they did. All right. You want to identify if there was any delays or neglect in the time of care. All right. You want to classify the death as, was it something we could have avoided, or was it something we could have not been able to avoid? Do you understand? You want to recommend what actions that will correct that thing next time. Do you understand? So you just want to identify, you want to collect the data, you want to analyze what you see, you can recommend actions, you want to evaluate. So types of audits, you have the facility-based audit. That one, they are just trying to evaluate all the mothers or women that have died in that hospital, know the various reasons that made them die. Community-based audit, that one is women that have been in that community, how many of them have died. So this one is a way of, it will help you develop the healthcare system better. You are knowing why people died, all right, and were there things that could have been done that would have prevented this death, or there wasn't nothing. Then confidential inquiry, all right, then maternal and perinatal death surveillance and response. So why it matters, it helps to identify systemic weaknesses in maternal care, improves accountability and quality of services, all right, provides data for policy making. Maybe sometimes the government needs this data to be able to make some decisions, allocate funds and all of that to take care of pregnant women. So they need this data to be able to do that. Empowers community and health workers to be able to learn and improve better in the services they provide.